Okay, so here's a treatment plan form, and I've completed it electronically, and you'll be completing it with pen at this point. Hopefully soon, that'll be electronic soon. But in the meantime, I just wanted to go through some concepts of dental hygiene, diagnosing and treatment planning, and just showing you how that translates to the form that we use. So it's important to label all the forms. You're going to want to put the name of your patient, your name, and the date for today. And here's that dental hygiene diagnosis section where you will circle all the issues that apply to your patient. And I just made an imaginary patient up in my mind, and I circled their issues, which were caries related and nutrition. And then I made, here's an example of a dental hygiene diagnosis: high caries risk related to demineralization and high sucrose diet. So then I imagined what my patient might say for their goals, and you would just ask them, what do you hope to accomplish with your care? And sometimes they might have no idea what you're talking about. So give some examples of things, and I'm sure you can pull back from the conversations you had with them during the assessment phase of something that might be of interest to your patient. And then you're going to create your goals, which should be based on their needs, their interest. So it's a layering. You figured out all the problems, you circled everything that applied. You chose the biggest issue that's relevant to your patient. You've assessed their goals, what's important for them, what they hope to accomplish, and then you've created a goal basically on all these issues. Then you haven't had radiology yet, but when you do, if you do any radiographs, you're going to put into the column where that is going to occur. So from this point on, this whole column is a list of services in different, this is educational components that you'll want to talk about, and these are the procedures that you may do. So what you need to do is select any of these things at which appointment you plan to do it. And this is implementation appointment 1, 2, 3, 4, 5, and then the last column is the reevaluation. So you want to think about putting what you're going to do in the appointment. Oh, sorry. Okay, so here are some educational components that I thought I'd want to talk about to my patient. I'm trying to scatter these each appointment. I think it's going to take 3 appointments to complete this patient, and I'm going to avoid talking about everything the same visit. I don't want to overwhelm them, so I'm going to pick and triage what I think the most important issues are, and then layer each visit bringing up a few issues. Then here are my treatment issues. So here is power-driven scaling, hand-activated areas, hand-activated debridement, so hand-activated with hand instruments, so with curettes. So here I'm going to put what area I'm going to do and sequence the whole mouth. And you can record this easy way. I just wrote maxillary right. You could make a little grid, whatever is easier for you. So here, the first quadrant I'm going to do the maxillary right side. Then I'm going to do the mandibular right side. Then I think I'm going to pick up time the more I go on, and I think I'll be able to do the patient's left side at their last visit. Then I want to focus on plaque removal method, and this is are you going to air polish, motor polish, or toothbrush and floss? And for this person, they had, I'm going to put toothbrush. So you want to write the method, not just a check mark that you're going to do it. And then the same thing for fluoride. I'm going to use a varnish method. So I've treatment planned that. Then you're going to, and these, you'll get more information on these procedures later. So then you'll just put the time of your appointment sessions that you plan on keeping your appointment for your patient. Then you're going to fill in your recall interval, what you're recommending. Here's where you're going to put any referrals. And then under current self-care methods right here, this is where I'm clicker happy. This is where I want you to put exactly what the patient does, current self-care. So they brush once a day with a rolling technique, and they floss once a week. And if they used a proxy brush, Sonicare, oral whatever they use, oral irrigator, all that stuff, if they use Listerine as a mouth rinse, fluoride rinse, all those things should be here. So you want to ask your patients all these questions and record their answers. You don't want me to come over and have to ask all the same questions over again. So this is current self-care methods, and then here is recommendations, and here's going to be what you put for your recommendations for your patient. Then you're going to complete your name. Then you're going to present it to your faculty member. They'll sign it, and then you will present it to the patient. Okay, so that's just the logistics of the dental hygiene diagnosing and treatment planning at Middlesex, and this is what our form looks like. You may find in other places they have different forms and different procedures. All the concepts should be the same. So you might want to save this video for when you're getting to see patients in clinic. You might forget all these little nuances of this form. So good luck treatment planning your patients.